All right, hello everyone. This is Dr. Mimi Tan. Welcome to our live seminar today. I wanted to start out, we have some excellent questions that have already been sent in ahead of time through our website. So thank you for sending those in. I want to start just by saying one of our questions that we got was actually in Spanish, and I will answer that question. And I just want to mention that once these videos are loaded, we will actually have Spanish subtitles as well as subtitles that are auto-generated by YouTube for all other languages. We have patients from all over the country and all over the world, and so I want to make sure that all of our patients do have all our resources available in the language that they feel most comfortable in. They're not perfect, so I apologize for that, but we do try our best to make things as accessible as possible. So let's get started. I'll try to make this relatively quick so that we do have time to answer everyone's questions. If you do have more questions that come up, please do put them in the YouTube chat below, or feel free to text us at this phone number at any point in time as well. All right. So I like to start this seminar with a simple question, and that question is weight loss hard? And it might seem like a silly question to start a conversation like this with, but I think it's actually a critically important question because we as a society for a very long time have actually answered this question incorrectly. For a long time, we have said, actually, no, weight loss is easy. All you have to do is try a little harder, eat a little bit less, exercise a little bit more, maybe have a little bit more willpower, and that's all it takes to lose weight. We've heard this over and over and over again. As a weight loss specialist, I hear this every single day. And if you are here today, I applaud you because you have heard this just as I have every single day of your life. And at some point you have paused and said, actually, no, weight loss is not easy. It's incredibly hard. What else can I do for myself to take back control when it comes to my weight? And I thank you for that. It's not an easy thing to recognize, and I applaud you for being here today. So let's talk about why you're actually right in answering that question that yes, weight loss is incredibly hard. This is a graph from the CDC, and this is weight trends in the US over the last 50 to 60 years or so. And each of these lines represents a BMI class. Now, if you're not familiar, BMI is a ratio of your height to your weight. There's a lot of criticism about BMI. BMI is not perfect when it comes to telling us whether or not someone is healthy or not, but it is something that we very commonly will use. Now, what we do see in this graph is two important things. One is that when it comes to obesity rates have been climbing over the last 60 years, steadily climbing, actually. And as of 2017, more than 40% of the US is considered obese, and more than 30% of the US is considered overweight. So about 80% of the US is either overweight or obese. And again, BMI is not perfect by any means, but what this tells me is that a lot of people in the US are really struggling with their weight today. And this graph only exists because weight loss is incredibly hard. And the conversation that we've been having about weight loss for far too long has been unproductive and ineffective. And we'll talk a little bit more about that. So why is weight loss so hard? And the reason that weight loss is hard is because it is complicated. There's a lot of different reasons why one person weighs what they weigh and why weight loss is easier for some people and harder for others. Now, when it comes to weight loss, there are a lot of things that are within each person's control, right? Some of these bubbles you do have a lot of control over, what your diet looks like, how much you exercise, who are the people in your life who give you support. Those are some things that we can change, right? But there's a really important thing in here that is very, very difficult to change, and it's actually very important. That's your biology, who your parents are, what your body chemistry is, what your hormone balance is. These are all things that we do not have easy control over in our day-to-day lives, and they make a huge impact in terms of, one, how much you weigh and how hard it is for you to lose weight. So if you are someone who has tried over and over and over again to lose weight, what I want to tell you is that your failure to lose weight is not a moral failing. It's not because you haven't tried hard enough. It's not because you haven't had enough willpower. It's a failure against your biology. It's failure against something that you don't have easy control over, all right? And I say easy control over, and that's because you do not have the tools. I call this your medical weight loss toolkit. And I say easy control because you do not have the tools readily accessible to you. You need some help to get some of these other tools, right? So lifestyle changes, that's the first one. This is diet and exercise. A lot of this people are very familiar with already. These are tools that you can have on your own. You don't need someone to necessarily guide you, although we will guide you in terms of what we have recommendations for you when you come see us when it comes to diet and exercise. The next is going to be medications. That's going to be a little bit more effective. And then the most effective tool is going to be bariatric procedures. And so let's talk about each of these in a little bit more detail. So diet and exercise. Diet and exercise alone is not a very effective tool when it comes to weight loss. The reality of the situation is that if you want to lose a substantial amount of weight and you want to keep that weight off, your success rate with being able to do that is going to be fairly low, around like 3 to 5% if you're trying to lose a substantial amount of weight. That said, I think diet and exercise, and diet in particular, is absolutely foundational. What do I mean by that? I mean that anyone who wants to use any of these other tools that we're going to talk about is still going to have to pay attention to their diet. This is just a piece that you kind of have to work on no matter what. If you're not eating the right things, if you're not eating healthy things, it's going to be really, really hard for you to lose weight and keep that weight off. And so this is something that we have to pay a lot of attention to no matter what. Now, medications is the next piece. And this is something that has gotten a lot of attention in the last year. It's all over social media. It's all over the news. And so let's talk about it in a little bit more detail. Now, broadly speaking, there are two kind of categories of medications that I like to kind of explain things by. One is going to be non-injectable medications. These medications, for the most part, we've actually had on the market for a long time. These are medications that you take by mouth, usually once a day. And the success rate of using these medications is okay. Estimated weight loss is probably around 5 to 10% with some of these medications. Now, the injectable medications, these are going to be your Ozempics, your Wegovys. These are the things that you're hearing a lot about in the news and social media, and they are newer. These are drugs that you take or that you inject, usually about once a week. Some of them you actually inject more than that, but most of them are about once a week. And they've gotten so much attention because they're a lot more effective than anything else we've had on the market for a long time. Success rates have actually been shown up to be 20% with, again, some of these really new agents that are coming out. Now, how do these medications work? Again, broadly speaking, these medications are going to work one of two different ways. Some of them work with both of these ways. One is that they might work on your brain and they really help to suppress your appetite. The other way that some of these medications, especially these newer injectable medications, are working is they work on your stomach and they really slow down how quickly food moves through your stomach so that when you eat, you feel fuller faster and then you feel fuller for a longer period of time. In terms of talking about the pros and cons of medications, I think the biggest pro when it comes to medications is that we do have lots of medications available. Now, each of these medications do have side effects, and some of them are pretty prominent side effects. And so it's really a matter of picking something that works well for you. And sometimes it takes a little bit of trial and error before we find something, but again, there are a lot of options that we can give you potentially. The big downside with these medications right now is a lot of these newer medications are undercovered or not covered by a lot of insurance companies. And in order to pay for them out of pocket with cash, it's very expensive, probably too expensive for your average person. They can also right now be very hard to actually just get a hold of. The popularity of these medications has really skyrocketed over the last year, and so a lot of our patients also struggle to just find these medications at pharmacies. The other big question when it comes to these medications is, what is the long-term durability? Do I have to take these medications for the rest of my life? We do these seminars every week, and I answer this question every week. And this week I get to say something different. Actually, on Monday, this has been something that we've been speculating about for a long time. And on Monday, a really great paper came out, a research paper came out on Monday that looked at this exact question. Do we have to be on these medications for the rest of our lives? And this is with one of these newer medications. It's called tirzepatide. It's also on the market as Mounjaro or Zepbound. And this study looked at about 600 patients, and half of these patients got the medication for like a year and a half or so. And then the other half of these patients got the medication for about half a year, and then they were switched without the people knowing it in the study to a placebo. So they were getting injections, but it was just saline. There was no medication in it. And what they found is that a lot of people lost a significant amount of weight in that period where everyone was getting medication. But once that medication was stopped, about half of that weight loss came back in the next year, okay? So what this tells us is that if we do start one of these medications and you want to maintain your weight loss, the best chance for you to do that is to continue this medication long term, right? And the next question is also, are you saying that I cannot stop these medications? I have to continue them long term. You do not have to continue them long term. If you've been on these medications and you've had success on them and you want to come off of them, what I'll tell you is that yes, you're at risk of regaining some of your weight, but we can still try, right? There were a percentage of patients in this study who were able to maintain their weight even once they came off of the medication. But what I would recommend to people is that if you do want to come off one of these medications, to do it in a way that is monitored. You want someone like me or one of our providers involved so that we can kind of make sure that you are not backtracking during your entire process, all right? Okay, let's talk about bariatric surgery. This is my favorite topic. This is the most effective tool when it comes to weight loss. All right. Estimated weight loss is going to be about 25 to 30% of your total body weight when it comes to bariatric surgery. And really, really importantly, in my mind, is that it addresses a lot of the diseases that are related to being overweight. So things like high blood pressure, sleep apnea, diabetes. Bariatric surgery is going to make significant improvements in all of those different diseases, and yet there are a lot more diseases than what is listed in here that are helped with bariatric surgery. So who should get bariatric surgery? These are kind of the guidelines, I would say, when it comes to bariatric surgery. The thing for most people maybe to pay attention to is the insurance guidelines. Now, this is what insurance says we will cover your bariatric surgery for you if you fall under this category. So if you have a BMI greater than 40 or you have a BMI greater than 35 with diseases related to being overweight, those diseases that we talked about earlier. Now, the medical guidelines, what major bariatric medical societies have recommended, these are new recommendations, and the BMI cutoff for these recommendations is lower because we have realized over time that a lot more people can actually benefit from a health standpoint from bariatric surgery. And so those cutoffs are a little bit lower. This, again, is tricky because most insurance companies have not caught on to these new guidelines, but this is kind of what I would recommend from my standpoint as a physician. All right. Now let's briefly go over what bariatric surgery looks like. Bariatric surgery nowadays is done minimally invasively. So that either means a laparoscopic or a robotic procedure. With both of these, we're making little incisions, about 1 centimeter in size, and then we put instruments in through these little incisions as well as a camera through these little incisions, and we do in the entire procedure through those little incisions. This is in contrast to how bariatric surgery was done but earlier, and that was through a much bigger incision that would go from your chest bone down to your belly button. As you can imagine, doing surgery through these little incisions has really improved both complication rates, so safety of bariatric surgery, as well as just healing after bariatric surgery and pain that people have after bariatric surgery. Now, the two most common bariatric procedures that we offer, and these are the most common procedures that are performed in the US today, is the sleeve gastrectomy and the gastric bypass. The gastric bypass, this is kind of the grandfather of bariatric surgery. We've been doing this for a very, very long time. It's a great surgery, it's effective. And what we're doing with it is we're turning your stomach into a little egg-sized pouch. And then we're bypassing the remainder of your stomach, so most of your stomach, as well as the first portion of your small intestine. And then we reconnect the other end of your intestine to that small egg-sized pouch. And so what we're doing with this surgery is we're limiting how much food goes into your stomach at one time that sits in that little egg-sized pouch. And we're limiting how much food or nutrition and calories is absorbed through that intestine that we've bypassed. So we're both restricting how much food is absorbed, how much food you can eat, and then how much food is absorbed. With the sleeve gastrectomy, what we're doing with that is we're taking out most of your stomach. About 80% of your stomach is removed with the sleeve gastrectomy, and we leave you with a thin banana-shaped stomach. And so the way that this works is that we're limiting how much food goes into your stomach at one time. Now there's pros and cons with the sleeve gastrectomy and the gastric bypass. There are some people where I might recommend one versus the other for you. And then for some people, for actually a lot of people, both of these are really good options. And we talk about the pros and cons of each of these during your consult. And then we can decide from there what is best for you and your lifestyle. Another thing that I wanted to bring up is the endosleeve or the endoscopic sleeve gastroplasty. This is a newer procedure, and this is not a surgery per se, and I'll explain why. This is an endoscopic procedure, and what that means is that we go in using a very long, thin camera through your mouth, and then through your esophagus and into your stomach. And there's a device attached to that long, thin camera where we are actually able to put in sutures internally into your stomach. And with those sutures, we bring down the size of your stomach so that the inside of your stomach is the same size as you would have with a sleeve gastrectomy, that banana-shaped stomach that we talked about earlier. And the very cool thing about this procedure is that it is not technically surgery. We do have to put you to sleep for the endosleeve, but there are no incisions, and so you don't have to recover from that aspect of the surgery. And so recovery time is faster with the endosleeve. We've been doing this for not a super long time, but the data that we have from the patients that we've had done the endosleeve on and from data that we've seen from other groups is that this is actually a pretty good surgery. It's not quite as good as bariatric surgery, but the weight loss that you would expect is kind of 20 to 25%, getting close but not quite there, but it's a great option because of some of the benefits that we already talked about. All right, I wanted to address two really big bariatric surgery myths that I hear, again, almost every single day. And so I wanted to just talk through them really briefly here. The first misconception that I hear about bariatric surgery is that bariatric surgery is so extreme. I understand where this comes from. Surgery does feel extreme, right? Why would someone choose to have surgery if they didn't have to have surgery? And I have two answers to this. And the first is that bariatric surgery is actually extremely safe. It is one of the safest surgeries that we actually do today. If you were to go to a hospital right now and look at all the surgeries that they're doing that day, bariatric surgery is actually going to be one of the safest, if not the safest procedure that is being done there. The other answer that I have to that is that why would you choose to do bariatric surgery voluntarily, right? Like, why would you choose to do surgery if you didn't have to? And the reason is that you are preventing with bariatric surgery. Let me rephrase this. Bariatric surgery is prevention, right? You're preventing other problems from happening, and those problems have complications that are much more than the very small complication rate that we see with bariatric surgery. And so for that reason, bariatric surgery does feel extreme, but in a lot of ways it is not. The other myth or misconception that I hear about bariatric surgery is that it's the easy way out. I hear this all the time. Or I hear that bariatric surgery is cheating. And yes, bariatric surgery makes losing weight easier. Yes, medications makes losing weight easier. That's the entire point. These are all tools that are supposed to help you lose weight, right? They're going to make you more successful. But the reality is, one, you do still have to put in a lot of work when it comes to either being successful with bariatric surgery or being successful with medications. Every single one of my patients will tell you that. All right. Bariatric surgery is a tool. You still need to put in work to use that tool. But yes, these things are going to make this all much more doable for you. That's kind of the point of why we're doing that, right? All right, this is a summary of everything that we've already talked about. This is a great slide to kind of take a picture of, just to remember for the future. All right, so what is Eviva? This is us. This is our weight management group. We're located physically in Shoreline, Washington, which is just a little bit north of Seattle, for those of you not familiar with the area. We, however, offer all of our visits through telehealth. So if you were to have surgery with us, the only time you have to be here is for surgery. We can do all of our other visits virtually. I love to see my patients in person if possible, but I understand driving around Seattle is not fun and that everyone is very, very busy. And so this makes things a lot easier for a lot of our patients. But I think what is more important than what is Eviva, where we're located, or anything like that, is who is Eviva. And I think this is so critically important. And I don't mean just who is your surgeon or who is your surgery team. That is important. It is important that you have a good surgery, obviously. But more important than your surgery team or your day of surgery is who are the people taking care of you before surgery and who are the people taking care of you after surgery. There are a lot of steps to get to bariatric surgery that can be very overwhelming for a lot of people, and understandably so. We have a lot of excellent coordinators. We have a great team of MAs here who will get you to surgery. And then after surgery, and this is super important, you need to think about who are the people taking care of you. Success after bariatric surgery, you will lose weight with bariatric surgery, but how much you lose and how much weight you're able to keep off is often dictated by how much support you get from your team after bariatric surgery. And so we have a great team of dietitians, of medical providers who are going to support you every step of the way after surgery, and give you all of the support you need to maintain this tool that we're going to give you. All right, so how do you schedule an appointment? This is our website, evivamd.com. You can click on the Contact Us button, and through that you fill out a form, and then you'll get a phone call from us or an email from us for next steps. All right, okay. And so that is the seminar portion. We'll start answering some questions now. Let's see here. Okay. All right, okay, so yeah, so we actually got a question before this seminar and then a question during the seminar that are related. And I'll kind of read both of them, but they're related. They're kind of related, so we'll talk about it together. The first one is, I had a gastric sleeve at Eviva, but after losing 60 pounds, I stopped losing and I still have about 40 pounds to lose. Is semaglutide the next step? Skin excision, question mark. Just looking for general next ideas, feeling discouraged, having lost momentum. And then the question here is, I'm a current patient who's 9 months out from my sleeve. I would like to add GLP-1 medications to my weight loss journey. What are the steps for doing that as a current post-op patient? Thank you for both of these questions. And this is an incredibly important question. And first of all, I'm sorry to hear that you're struggling. This is never what we want to hear, but the reality is that it's very common to both have weight stalls and have issues with weight regain after bariatric surgery. And so let's talk about that a little bit more. First of all, I think both of these people are still relatively early out. But I recognize that you guys have like a little bit more weight that you want to lose with bariatric surgery. And there are a lot of different things that I would recommend. And I think this topic is a little bit, I wouldn't say controversial, but every single surgeon that you talk to and every single provider that you talk to is going to have a slightly different answer when it comes to talking about losing a little bit more weight or talking about weight regain after bariatric surgery. And the short answer that I would give you, and this applies to anyone who has a question similar to this, is that I want you to come in and see us so that we can discuss what your goals are and how we can help you achieve those goals. The reason why you might not be losing as much weight as you want, and the reason why you might be regaining weight, is oftentimes multifold and multifaceted. There's a lot of different reasons that might be contributing to that. One might be behavioral. And what do I mean by that? When you first have bariatric surgery, your lifestyle is completely different, right? Your eating is completely different. Everything, you're adjusting to it and you're learning a new habit, a new way of eating and drinking and exercising and doing everything in your life. And so as you're forming these habits, it is in the forefront of your brain. So you are super on top of everything when it comes to what are the right things to eat, what are the right things to do. Now, as that habit gets formed and solidified in your brain, there's something that happens that's called behavioral shift, in that you make small changes over time that might not be the most conducive to weight loss and might be conducive to weight regain. And you might not even realize that you're doing some of these things. And so it's super important to kind of talk to us so that we can kind of figure out if that is something that's happening. Now, another thing is that there can be anatomical issues at times. And so there are things that we can do to kind of figure out, is there something with your anatomy that we can address that might help you gain a little bit more or lose a little bit more weight. I would say both of these things tend to happen a little bit later out than, they tend to happen over a year out after surgery and not within your first year. Now, if you do want to get, the other thing is, as you guys have already mentioned, is medications. What is the role of medications after bariatric surgery? In my mind, I think a lot of people can benefit from having multiple tools. So having both surgery as an option and then also having medications on top of that. That can be a really great option to help you get to where you need to be. And so that is another discussion that we can certainly have. Sometimes, again, this kind of depends on the conversation that we would have during your visit with us, but sometimes I would want you to kind of wait a little bit longer before we decide whether or not to start you on a medication, because you do potentially still have weight to lose in that first year. Stalls are normal after bariatric surgery, and sometimes you'll just continue to lose after you break that next stall. And so again, this is so personal to each person, and so I would recommend that you kind of come in and talk to us for sure. There was also a mention of skin excision and whether or not that would help you. Generally speaking, skin excision I don't recommend before the first year for the same reasons that we just talked about. Most people will lose weight and continue to lose weight in that first year. That's not everyone, but most people will. And so I really want to make sure that your weight has stabilized before we send you for something like weight loss or skin excision. All right. Okay. Let's keep going on these questions. Now, this next question came from Vicky, and this one came in Spanish, but it's am I a candidate for bariatric surgery? And I also got a similar question on Instagram about how do I know if bariatric surgery is right for me? These are similar questions, but they are a little bit different. But I do want to answer them together. In terms of whether or not I'm a candidate for bariatric surgery, I would say that we should pay attention to these guidelines that we talked about, especially if we're dealing with, again, insurance requirements. If you want insurance to cover your surgery, you are going to have to fulfill this criteria of a BMI of greater than 40 or a BMI of greater than 35 with diseases related to being overweight. Now, the answer of how do I know if bariatric surgery is right for me? That is a deeply personal question to each person, and we can certainly talk through that during your consult. Generally speaking, yes, we can use these medical guidelines or these insurance guidelines to recommend bariatric surgery. But is everyone with a BMI greater than 35 or a BMI of greater than 30 with some diseases related to being overweight, do all these people need bariatric surgery? Not necessarily. I think this is something that we need to talk through because there are other options available, right? Like medications specifically. And when it comes to deciding between your different options, you have to weigh the pros and cons, right? Everyone is going to be a little bit different in terms of what they're willing to accept in terms of risk, what they're willing to accept in terms of lifestyle change, eating change. These are all things to think about and kind of weigh for yourself. I can never fully answer or give you the answer of whether or not bariatric surgery is the right option for you necessarily. And so most people, this is going to be something that is very, very personal. All right. That said, I think that if you are at a BMI of greater than 40, or if you have comorbidities, or that you are at a BMI that's higher than you feel comfortable with, and you have people in your family who have also struggled with their weight, and they all have hypertension, they all have diabetes, and you are really wanting to minimize your risk of developing those things, or if you already have some of those diseases, I do think bariatric surgery is going to be the best option. It's the gold standard. It is going to be the most effective tool for you when it comes to weight loss. And so I think bariatric surgery, is it right for everyone? No, but is it right for a lot of people? Yes, absolutely. All right. Let's move on to the next question. Is it safe to get bariatric surgery outside of the country? This is a question that I got from Instagram, and I think this is a great question to talk about as well. And I think that this is a bit of a complicated answer. I think it's best if you have bariatric surgery where you currently live. And the reason I say that is it's not a safety issue necessarily, I would say. Are bariatric surgeons in other countries as good as bariatric surgeons in the US? Yes. I think they're just as good as, for the most, again, there's good surgeons, there's bad surgeons, but for the most part, yes, there are good surgeons everywhere. They're going to do a good surgery for you for the most part. Now, my concern is the aftercare when it comes to bariatric surgery. If you go to a different country for bariatric surgery, likely you're going to have minimal to no aftercare. And like I said earlier, your success with bariatric surgery is largely determined by how much support you get after bariatric surgery. Yes, you will lose weight with bariatric surgery if you get it here, if you get it done at a different country, but how much weight you lose and how much weight you are able to keep off is largely going to be dictated by how well we teach you how to take care of that tool and to use that tool. And so aftercare is critically, critically important. When you're choosing a bariatric surgeon, you want to choose a team and a surgeon who is going to be able to provide the most comprehensive aftercare to you possible. That would be my recommendation. All right. Okay, and then let's see here. Last question that I have is, I have unused insurance benefits for 2023. Is there anything you would recommend that I could use these for before the end of the year? This is a tricky question for me to answer. I think this largely is going to depend on your specific insurance situation. And without knowing that, I don't know if I can answer this super fully. And so what I would recommend to this person is to actually give us a call so that we can look up your insurance information and give you some more specific advice, I would say. It's really hard for me to recommend anything without knowing a little bit more here. I'm sorry. Okay. I think that is all the questions that we have today. All right. Okay. Well, thank you so much for tuning in, everyone. Thank you for sending questions in ahead of time. Thank you to everyone who sent in questions through social media. This has been really great. So I hope that everyone found this helpful. All right. Bye.